them?
No.
Oh, okay. Oh, I don't know why. That's strange, isn't it? So it might be a good idea, Fatima. Yes, let's just.
Okay.
Yes.
Not a problem.
Yes, thank you.
No problem. My pleasure.
Yeah, and then I actually I don't have to concentrate too much then on the
slides.
Yeah.
So I'll say present.
Yeah.
There.
Okay, and you must chip it. You and Nabil must chip in whenever you want. Just say if you want to.
Okay, sure.
Yeah, if you want to add things. All right. So hey, welcome back, everybody. So we're here at session 3, and I really appreciate everybody being here. So we're getting into a format here. So yes, today's skills, which will be sort of touching on a capacity building, so your ability to identify problems, strengths and resources, and ability to build connections and coalitions. And I think one of my colleagues may be joining us who works with me on the Pastors for People, Dr. Diana Ingram. And so she may be coming in, and that would be, again, a nice way of sort of introducing you to some of the other research engagement partners. And also, I think, as we're going along, just building connections and coalitions, which is always the most powerful thing to do, people. Okay, and then we're also going to be thinking about, I'm going to introduce you to I think along the way, and this is certainly something I'm learning very much from working with everybody, is the ability to practice cultural humility. And so that's something I think we'll be able to share, because I want you to introduce you to the idea of underserved populations and what that word means, and then what it means in a sort of in your context as well. So, and yeah, as usual, the ability to identify resources, and we'll begin to introduce you to a tool. As you know, I like introducing everyone to tools. To help you participate in a community assessment. So we're going to begin to introduce you to something called asset mapping. So you've done ever so well so far, because you've stayed with us as we've gone through the big data, and now we're going down. We're crunching. I don't like the idea of going down, but from my point of view, we're getting to the exciting bit where we begin to see how the big data connects with you and your communities. So if we go to the next slide, and the other thing I wanted to say is that I'm very conscious that we haven't acknowledged the situation that we're all in at the moment, the reason why we're virtual, and I also know that many people have experienced these losses of loved ones, and so I hope. Yes, I know that we're all thinking of. I hope everybody knows that yes, it's a difficult time, and we're hoping that the training that we can put together helps you at that time, and I hope actually as you go forward you can perhaps see how research engagement may actually help to change systems and structures in ways that are better responsive to the current situation that we have. So I thought we'd start by saying, I just thought it would be nice if we could all share something that made us smile or inspired us today, just sort of to get us sort of moving on from the hard day's work that we've all had, and then sort of thinking about moving smoothly and mellowing into the evening. So I can start. So I was talking to my nephew today, who he's 9 and he's gone back to school in the UK, in England. And he's a bit worried, and his mother was very, very worried about going back to school. But he was telling me he's really pleased to see his friends again. And in the UK, they don't ask kids at that age to wear masks, but they just say they're not to come to school if they have a cold. But what he was telling me is he's telling me that the little boy sitting next to him he was touching him, and it just made me think that I bet he was touching him to just check he was real. I just thought, I bet that's what's going on here. They're not sure. So I think that's what I interpreted it. Yeah, he was just checking he was real. So that made me smile today, and yes. So yes. Maybe Fatima has something. What about you?
Oh, yeah, I was thinking about it. It's a crazy day today.
Yeah, I know. You're all smiling. You do well. So,
yeah. I don't know. I can't think of. I smile a lot, actually. Yeah, I'm just thinking. I was thinking what has, or maybe.
Yes. Yeah.
I can go. You don't want to go?
Go ahead, please.
Earlier today, I saw I was driving by in the car, and I saw in another car, I saw a dream catcher. And a dream catcher, whenever I see one, I get inspired, or it uplifts me just on the strength of what a dream catcher symbolizes and represents.
Yes. Yes, I love those too. Yes, that's nice. That's very nice.
I can go next.
Mm-hmm.
So today.
Is that Asna?
Yes, Asna.
Okay. Oh, I'm recognizing voices now.
So today, something made me smile. My cat was following me everywhere today for some reason. I don't know.
Yeah.
That just because she usually follows my mom everywhere. So.
Yes. No, that's very nice.
Assalamualaikum. I can share. Hello. So this is Shama. Yeah. So today something that made me smile and like inspired me was my husband and I, Bilal, we've been dealing with some issues with our like leaks, the water leaks, and so my husband's grandmother called us to just see how we've been handling the situation. And as our elderly do, she was like, you know, are you praying namaz? Like, are you praying? Are you doing these things? And then I was like, yes, we are. And she's like, okay, then don't worry. Your plumbing is going to get fixed. And we're like, yeah, you'll be okay. So, yeah, that made me smile today.
Yeah.
Yeah, that's so true. Eventually, we all come to believe that prayers are the things that, that's how things get done.
Yes. Yeah.
I think I can go next. The thing that made me smile today was it's my younger sister's birthday. She's turning 13. She was so excited. So excited to be a teenager that she's in Saudi actually right now with my parents, but she stayed up until right before midnight and started messaging everyone in the family.
Oh,
and then insisted on calling everyone, and then she insisted on telling us the story of this year and what it meant for her. And one of the things she said, she's like, you know, when I turned from 11 to 12, and it felt like when I was like 11 years old, it only lasted 4 months, and then when I was 12 years old, it literally felt like 5 years because of COVID.
Wow.
Life is.
Oh.
Right. So I thought that was precious. It kind of reminded me of how, you know, like time is so subjective and things happen, but you know, we learn and we live.
Yeah.
I can go next. This is Maher. Assalamualaikum, everyone. Something that made me smile today. I have a couple friends living in different states after we graduated, so I just finished baking a batch of cookies, and I picked up priority mailboxes from the post office. So I was just picking stuff with them and writing cards and stuff. So I'm looking forward to making them smile.
Oh wow, that's such a nice thing to do.
That's very nice. Yeah.
Beautiful.
Welcome. I can share next. So I just came across this online class by Numan Ali Khan for Arabic, and it's like a live online class. And so he has like 2 students with him that he teaches while he's doing the online class, and the way he like interacts with them and like jokes around with them and stuff, it's like really refreshing.
Yeah.
So yeah, it was pretty funny and interesting to watch.
Oh, thank you. Thank you for sharing that. Yeah. Yes, I think humour is a very important thing at this time. Okay, shall we? If anyone else would like to share, or you can think about it and maybe sort of come back to it later on. So, okay. So perhaps should we move through, Fatima?
Sure.
Mm-hmm. Okay, so I'm just we're just introducing some ideas, some knowledge checks, because you're beginning to sort of acquire a lot of knowledge. We're introducing you to an awful lot of knowledge, and so what we thought is that just at this moment in time, we just wanted to get a sense of you know, how you're feeling about things. So how much do you know? Do you think you know about patient-centered health research? Would you say nothing, a little bit, a fair amount, a great deal? Or I don't understand patient-centered.
Oh, I was just going to ask that if people can actually, in the chat box, if they can just write down the letters A, B, C, D, that would be great, because we are actually doing, we are doing a knowledge check. So how we want to know how we are doing, and whether this material is making sense. So it's about that. So your answers are very important to us. So each one of you can just simply put it in the chat box and then send it to us. That'd be great.
Mm-hmm. Mm-hmm.
Sister Fatma, do you want them to do question 1 and then the answer, question 2 and then the answer?
Rebecca would be reading that, I'm sure. She's going over the slide. Yeah.
Yes. No, thank you. So, okay, so that's okay, good. that's excellent. I was because this is only session 3, so I'm very pleased that you feel as though you're getting a little bit, and that perhaps moving towards a fair amount. So that's nice. Okay, so we're moving in the right direction. That's good. All right. Okay, so which of the following health conditions do you remember? You know, we did the big data. Do you remember? Pardon?
You're not muted.
Oh, I'm sorry.
Oh, okay. Oh, yeah. So which of the following health conditions did the big data tell us was the most frequent cause of death for all men and women in Illinois? Was it? Sorry, we got. Was it cancer, heart disease, diabetes, or chronic conditions? Can you remember which one? Yay! That's right. Okay. Now, okay. So, do you? Okay. So, and then finally, which of the following? So good. So you understand what a health condition is. You've got a sense of the health conditions, and you've got a sense of the dominant ones, which are impacting all of us in Illinois. And so which of the following factors, health factors, do you think impact the life expectancy of people living in your community, area, town, or county? So do you think it's smoking, access to healthcare, housing, and transit? I mean, this is you deciding just those. These are 3 examples of health factors. So we're just wondering what you think is the biggest impact on life expectancy in the people that you know. All of the above. Thank you. that's often thank you. Lovely. Okay, so good. So I just wanted to make sure that you were cool about the idea of health condition, you know, the words that we're using, and the health factors. So yes, and Fatima did a fantastic sort of job last week of painting the picture of the healthcare sort of world as it is. And I think it's interesting that some of you selected smoking there, and housing. Don't think there's anyone that had. Oh, well, there's all 3, and I think that's exactly as well. Is that with health factors are complicated because there are many, and also. Fatima talked about social determinants of health. So one of our goals, I think, as community health workers, is to be alert and listen out for the things, be observant about the things that you think are impacting life expectancy of the people you live and work with. Great. Okay, good. Oh, that's a good start. Okay, so we're going to continue to identify sources of information found in the spectrum, and I'm going to continue with the mainstream, but then I'm going to move a little bit more towards the grassroots, so we can see how the mainstream and the grassroots can connect and benefit from each other. Okay, next slide. So today we're going to think about these keywords: patients, the word, as I said, underserved patient populations, and patient-powered research networks. I'm going to sort of introduce you to patient-powered research networks, which are sort of alliances of patients that PCORI sort of thinks of as communities of patients who are living and experiencing the same health conditions. Okay, so if we go to the next slide. So patients are defined by PCORI as they talk about patient partners, and those are people who are representative of the population of interest in a study, as well as family members, caregivers, and the organizations. And the key thing is that they are sort of members of the research team. Then there are other people, there are other patients who might be recruited to the study. And they are often referred to as patient subjects. And then if you're familiar now with the patient-centered outcomes research, we define that early on. So that's research that helps people and caregivers communicate and make informed health decisions. And what I'm going to introduce you today is the patient-powered research networks. I'm going to sort of show those to you and give you a sense of how they operate and what resources they have and what opportunities they offer. And tomorrow we will meet a lady who runs one of those patient-powered research networks. She runs Creaky Joints, and she's a really nice lady, and she'll be able to talk you through what that does. And I will introduce you today to Creaky Joints a little bit so that you're prepared. And then if you could all come with a question for her tomorrow, that would be great. So patients, different patients are individuals who have or have had the condition under study. So they might include patient surrogates or caregivers as well. And it can also include patient advocates or navigators. And you, in some ways, are patient navigators because you're helping people join the dots. You're helping them to, and advocates often do that as well. Some of the advocates, community-based advocates I know who, like Candice at the Blue Hat Foundation, she actively sort of searches the new literature for anything to do with her condition, and she advocates on behalf of patients with colorectal cancer. So patients, and the difference between patients and public stakeholders is a public stakeholder is us. And this is why I have such an emphasis on tools and resources, is that we are the stakeholders who can help the patients navigate the health systems. And we use tools to do that, and many of the tools are coming out of the research projects that PCORI funds. So it's a little bit, some of this language is a bit strange, and people have often said to me, well, where's the word community? But I think, as you can see, public stakeholders is a version of it. It could be a community organization, and a patient advocate could be a representative of a patient community-based organization. But this is the way that PCORI refers to the individuals who are at the table, and that's how they define patients. So, have the next slide, Fatima. Mm-hmm. So, going back to the slides before, the most studied populations of interest, patient populations, PCORI sort of divides it into. It classes people, racial and ethnic minorities, lower economic status, older adults, women, and individuals with multiple chronic conditions. So those are the most often studied groups. Okay, next slide. And then the most often studied conditions, and you won't be surprised to see cardiovascular disease as one of those because of the link to the big data that we looked at. Are mental health, mental behavioral health, cancer, neurological diseases, cardiovascular, and multiple chronic conditions. And what's interesting about chronic conditions is that can be it literally means a collection of conditions, a collection of health conditions. So you've got the most popular studied groups of people and the most studied conditions. And as you can see, the categories they're using are really directed by the big data. They're you know, you and I wouldn't necessarily describe ourselves, you know, wouldn't say, I am a member of a particular racial and ethnic group. We would say, you know, but we are all categorized into those for the purposes of health research. And equally, we might refer to our conditions in different ways, but these are the terms that they are asking us to identify our health conditions by, if we have them. Okay, so next slide. So to give you a big picture, thank you, Fatima.
I loved it.
Thank you very much. So what does PCORI do? So, and Fatima did that wonderful big picture of the whole healthcare system. And so this is the organization, the PCORI organization. So what it does, it has a steering committee, which is open to the public. You can listen to many of the debates which happen. So you can hear them making decisions. And their response to the COVID crisis, for example, was great because it was actually, you could listen in, you could hear them debating at the steering committee, and that was really good. But what they have done is they've set up these two networks, a clinical data research network and 18 patient-powered research networks. And I'm going to, in their view, those are two communities. It's a community of people who are all coming together to share clinical data as part of the research. And it's also people who are coming together around health conditions, patients who are coming together around health conditions and powering what the researchers should look at. Of course, the conditions are defined by the Institute of Medicine. So it's a list of conditions which have been agreed. And there's an issue with that sometimes because it isn't always clear why some conditions aren't there or why they're described in certain ways. But that's how they've put it all together. Okay, so if you go to the next slide. So this is an example. These are all the participating networks. So there are the data networks and the patient-powered networks. So one of my favorites is the advanced one here, the advanced collaborative, because this is actually about sharing data across community health centres. That's a network of community health centres who share data. And they have done a number of projects. If you go onto their website, you'll be able to see the collaborative projects that they've done. So they've collaborated, I think there's one in Oregon, and they've also collaborated with different states. So it's at that level, people are crossing states, they're partnering together, they're sort of finding common areas of interest. The other one I wanted to point out to you is the arthritis power. Now, this is not a data sort of network. This is a patient-powered network, and this one is basically where you've got people with arthritis and chronic conditions basically coming together and saying to researchers, you don't understand how painful it is. Why do you give us, the doctors don't understand how painful it is. We need some research to sort of help us alleviate the pain. So that website is full of resources for people living with chronic conditions. I think they're one of the best. They were very early in their response to COVID. So there's some very nice, very good resources to help older adults particularly deal with COVID on that site. And it has blogs and it has videos and it has very accessible things. It also has a research registry, and we'll come back to that. So Shilpa is going to join us tomorrow, and she'll say a little bit more about creaky joints and arthritis power, which is the research registry which goes with creaky joints. So yeah, and feel free to pop any questions in the chat because I know this is all a lot to absorb. But as you can see, there's the epilepsy network. There's a community partnered participatory research network. There's a network which is the University of South Florida. So these are all these centres are based across the states. That one focuses on breast cancer. And if we scroll down, I'll be able to show you some examples. So, and these are the research. So associated with a lot of these are research registries, where patients with the conditions that the centres are looking at can sign up to be part of studies. Now, I like this one, the COPD PPRN, which means it's respiratory. It's chronic respiratory COPD,
Chronic obstructive pulmonary disorder.
Thank you. That's right. All these, I know that. I just, yeah, my mum has that. I should know that. It's just COPD, you know. So yes, so I like that one because it has little. It does use a lot of visuals, and you don't have to sign up to get the resources. So with some of them, you have to be a little careful because some of them are actually asking you to sign up. And almost sort of assuming that you want to take part in any study that they have going. So the other one, which is nice, is the Healthy Heart study, and that's based in San Francisco, and they have some very nice sort of projects going. And you can actually, if you want to, you can track, you can join it, and they will enable you to track your symptoms, as indeed Arthritis Power does here, track your symptoms and help advanced research, but they will also tell you how you're doing, and you can link it to your doctor, so you can talk to your doctor about taking part in this and make sure that they know what the most up-to-date treatments are, but also know that you're taking part in these trials. Okay, so here's the next slide. So this is the Healthy Heart one on the left. So you can see that it says, for example, it says take the survey, and it's asking you for basic demographics, and you know what that is now from what we did, you know, we were talking about that yesterday. So it's basically asking for your age, your gender. I don't think it asks for one thing I do find when I'm working with a lot of groups, it's asking for people's social security or their how much they earn are not popular questions, and my memory is that they don't ask for those types of questions. But that's something also, and it's quite good if each of us just tries it out before we recommend, just so that you know what questions are being asked, because that can be very off-putting for people. So the other one is the About network, and this was an example which was about hereditary cancer research, and this was an example of them explaining what the project was all about and also what the network was about. Okay, have next slide. So yeah, this is Healthy Heart website. It's telling you what they're doing. So it answers simple questions. It doesn't take long. They don't think 30 to 60 minutes is long, but I think it's long. But so that's researchers for you. They're not all that long. They're not all that long. This Healthy Heart one was a long one, and they do then check in with you. You do need to provide an email, and they will check in with you and share with you the projects that they're doing. So yeah. Okay, next slide.
I just gotta say something. Beat heart, so it matters when the beat comes, before or after.
Yes. yes, indeed, that's right. Yeah. But you'll understand why there's a Healthy Heart is such an important one, given, you know, we were talking about that being a really a big sort of factor in reductions in life. Reasons. It's hard to use the word death, isn't it? But yes, it is a big thing in Illinois. So this is the About. It's the that's a little bit more about. So to give you an idea of the types of information they give you, they do many of them. Once you get to the point where you actually want to join a registry or take part in a trial, they ask for your consent, and so it's very much read the form. And I have to say, not all of them are very good at presenting these things in different languages. Some of them are better than others. But if you can if you sort of, once you know the area that you're wanting to find out more information about, maybe as a group we can sort of, and you say, well, you know, I've had several people ask me about breast cancer, or several people ask me about heart disease. These are good sites to go and find out what the science is that's going on, and also the resources that are coming out of the research as well. Okay, if you have the next slide. And then there's an Alzheimer's one, and then the NIH is also doing registries as well, and that's the All of Us. Okay, so that's the patient-powered research network, and so those are all PCORI's communities of research engagement. Okay, if you have the next one, focus. And so yes, and these go on. So there's a COPD one, and there are other ones. So take your time and have a look through these. A next one, I quite
PCORnet. Dr. Rebecca, do you want to explain the PCORnet?
Well, that is this. It is the PCORnet is the collection of patient-powered research networks, which are all online. So I can't remember when it changed its name, but this is what it is. Yeah, and so the Mood Network is very nice as well. There's some I find that very accessible, and that you don't have to sign up for anything for that one, and it gives you sort of free. There's an app that you can download, and there's some nice little sort of stress relievers and little bits of information about the projects which are going on in Massachusetts. Okay. Okay, so hopefully now you've got a sense of you've got an example of health outcome, and also understand what a patient-powered research network is. Okay. Right. Okay. So speaking same language. So the next thing I'd like to cover with you is the idea of what's underserved or underrepresented patients. Who are they? And what are public partners? And the communities and organisations who are supporting the patients. So let's start with this term underserved, which you may or may not have come across. Okay, if we go to the next slide. So 38 PCORI projects have the phrase underserved in their titles, right? You can go to the website and you can search. There's a search engine which enables you to search for the project. So I thought, right, because underserved is something that I find very difficult to understand. I don't necessarily know what's meant when you talk about underserved patients. So here's some examples. Testing a mental health program for underserved patients with lung cancer and head and neck cancer and their caregivers. Comparing 2 ways to mitigate the impact of COVID-19 on mental health among adults from underserved and racial minority communities. And then there are other ways where there are other ways of referring to underserved communities, and these projects came up when I put underserved into the search engine, but they don't use the word, which tells us how they're defining it, what they think of, what they consider that word to mean. So communities with fewer resources is one way in which underserved is interpreted, and then there's also for example, testing the appreciative query and bootcamp translation methods for identifying, sharing local solutions. So this idea that there's local solutions to healthcare issues, because again, the implication is that there is no access to services. That's actually a rural project, rural-based project. And then does a video chat referral process help families with children who have Medicaid to initiate mental health care? Well, that suggests that PCORI thinks that families and children with Medicaid are underserved patients, underserved populations, and testing new ways to schedule appointments to help patients access care. Again, that seems to be about access to care. So So I've sort of from this, because when I went to the glossary, there isn't a definition of underserved in the glossary. So Fatima, is your understanding? If we go to the next slide, let's see whether that aligns with your your understanding of what. Yeah. So I think underserved means underrepresented in research, because there's a lot of research which is actually was conducted with white participants, and so one of the things that PCORI is trying to do is it's trying to make research represent America, but it also means under-resourced, and this is how the Department of Health and Human Services characterises underserved. And also then the word vulnerable comes in. So it's underserved, vulnerable and special needs populations as communities that include members of minority populations or individuals who've experienced health disparities. So I think that's another way of thinking about it, is it's groups who are experiencing health disparities. And as you know from what Fatima was saying yesterday, that could be due to the social health factors, social determinants of health, which impact on the length of life people have or their access to care. And then this word vulnerable, which is always a difficult word. I mean, I work with older adults, and I really don't like the word geriatric or frail, because for me, it's about, it places people in a position of weakness. And then, of course, and so the word vulnerable is a difficult word sometimes, as is underserved, because it can often be equated with poor. And then a whole series of stigmas and identifications can come up. People, you can never say to somebody, it's hard to have a communication with people saying you're a vulnerable, you're a vulnerable person. So it's very important for researchers to understand this language and then translate it in ways which are acceptable and sort of respectful with the groups that we work with. So yes, but I think effectively, in my mind, it's limited access to health coverage. It's under-resourced. It's groups populations who are under-resourced. Would you agree with that, Fatima?
Yes, I agree.
Okay. And okay. So yeah. So any of you have if you've got any comments on any of that language, please do ask questions, or sort of. Pop it in the chat, because I'm assuming that you work with what the department, your majority of people you're working with are considered underserved, possibly vulnerable by government bodies, by federal groups, and this is the type of research that you will be approached that researchers will want to work with you on.
Yeah, so we do find quite a bit of the reasons why, especially Dr. Pajela has done quite a bit of work on this, and he has proved that Muslim communities are underserved because of the health disparities that do exist.
Yeah.
And that's, for example, in mental health, it was shown that 1 in 4 Americans are general population. 1 in 4 people is vulnerable, and then within Muslim populations, it's coming out as 1 in 3 people are vulnerable, and more towards. So there are certain things that are highlighting, and we need to pay attention to it now before things, go even further. Yeah.
Yeah, thank you. No, that's great. And obviously, COVID is going to have a huge impact on, first of all of the data that we just presented. I was reading today, actually, that already, I think, mortality rates from COVID-related chronic conditions, sort of, it's number 3. So it's already up at number 3 in terms of it's moving up. So that is going to skew things as well when we're looking. We have to take that into account when we're looking at health disparities. Okay, so the next slide. So the question, I think, Fatima posed very helpfully is: are Muslim American patients underserved? Are they patients? And so she very kindly pointed me to the Pew Research Centre. And so 70% of the total Muslim population is foreign born, as opposed to 47% of all US immigrants. And why is that important? Why is that important? Well, if you move to the next slide, it's about who has access to healthcare. And if you look at this slide, you can see that the majority of that if you're US born, you are more likely to have access to, you're more likely to have sort of public health insurance or have private health insurance. But if you're foreign born, you're more likely to have no health insurance. So there's going back to this idea that there's a business, there is that it is relevant. That data does sort of follow through. Okay, so the next slide.
Wow. This is interesting.
Yeah, good. That's good. So yeah, and so there are, again, when we start breaking it down by people who are not citizens, it is, and this is an example of women. So the 6.2 million American women who can have children but are not citizens are much less likely to be insured. And so, and those who live in poverty are often barred from Medicaid, are also, because they're not citizens, are also less likely to have insurance. Nothing scarier, I think, than giving birth to a child with no guaranteed access to health coverage. So that to me is a very salutary slide. Okay, so yeah. So speaking the same language, so yes, so we've seen, you've followed us through on the journey. You've seen how big data organizes patient populations, and you've seen how people get sort of, the big data is easy to we put it into zip codes. We start talking about suburban and urban populations and rural populations and neighborhoods and community areas. So let's focus a little bit more on the patient partners who are, which I'm thinking is something like Worry-Free, Fatima's Worry-Free, it's Pastors for PCOR, the organisations that represent those patients who are considered vulnerable and underserved. As you know, a broad range of communities have a stake in generating useful and relevant healthcare research, but do we actually know who we can draw on? Do we know all the assets in the community that we can draw on to help us sort of meet the needs of our communities? And PCOR, so it talks about patient partners, and I think you are all examples of patient partners. You may also be patients and caregivers, as I said last week, but it's yes, you're also your patient partners, and other stakeholder partners could be clinicians, community members, healthcare purchasers, payers, industry, hospital systems, policymakers, training institutes, and researchers. People are assets. They are real assets. And I think one thing that Dr. Ingram and I and Dr. Davis with Pastors PCOR have realized is that people bring so much experience to the table, and they have so much relevant experience, and they share. And I just, yes, that's what I mean. You know, people are powerful when you come together because you can share your knowledge and understanding. Okay, so next slide. So what I want to ask you is just to take a little bit of time to think about what you think the definition of our community is, and how would you like to define that? Because this will help me put together the asset mapping documentation, which will help you when you're partnering with the mosques. So you're going to be doing asset mapping with the mosque stakeholders that you've been sort of assigned to. But I would really welcome some, if you had a think about what does being a partner mean to you? What is it? Is it about, how would you define, are we a group are we a group of faith-based communities, health researchers and other stakeholders working together? Are we the group? Is it a group of mosques? Do you think it's relevant to have, therefore, the zip code of the mosque and the zip code of the Muslims who attend that mosque? So you've got a sense of a radius, a map. We can create a map. Do you think it's relevant? Do you feel more comfortable with thinking about the neighborhood you live in and the people that you engage? So I was wondering if we just open it up for some thoughts on that. So how would you think of ourselves, or is it all of those things? It could be all of those things, but or how would you like this list to be defined? The idea of or is it worry-free? Is worry-free the organisation which is partnering with the mosques, and you are sort of champions, PCORI champions? Yeah, how would we like to imagine it? So this is at the bottom, it says a faith-based community is driven by a group of people of faith who share a common interest relating to spiritual, social, or cultural matters within the area that they serve and live. So that is actually Dr. Davis from Pastors for PCOR. She came up with that. She devised that. So that's one way of describing faith-based. Because sometimes when you say I'm doing it, it's a faith-based project, people don't really know what you mean. And when we went and presented in Arkansas, for example, people said, "Oh, you mean the church?" But I think as part of Pastor to PCOR, we're thinking actually, no, it's not just a collection of churches. It's more of a sort of a faith-based community. There's a common interest there. There's a common goal. So we could define ourselves as an alliance of legally structured organisations driven by a group of people of similar faith, and that's what Dr. Davis also, in the back of her mind, she has that to meet a specific purpose. So, which is also fine, but it's thinking about the organisations. What is our definition of community? What will we need? What will we want to find out about our community? So.
One way to think about is, and I just want to aid and facilitate the thinking process for the group here. And I personally, I would like to hear from the group as well as what are they thinking of the community itself. So, each one of you, when we first started the project, we had 4 different mosques in mind, or 5 different mosques in mind, and we were looking at the people, the people who come to that mosque. We were looking at the resources that were there. We were looking at the experts who came to that mosque or who ran the mosque, or if there are any health programs that's going in the mosque. So we kind of picked out on 5 different mosques, or 6 different mosques, in fact. And we were looking at that. But we are, and that's what we called we partnered with in this project. But I still don't know whether that's one community or 6 different communities, or each one of us has a different community that we are bringing together to form another kind of community. So we need some help here, guys. We need to see what the community needs.
Yes.
I can share
Please.
like my understanding of the community is, like, because like this project is focused on Muslims, so like the Muslim community. So for me, it's like the mosque that I pray in and the people that go to that mosque, and the areas they live in. They don't have to necessarily live in the same like city where the mosque is, but they still like come to this mosque, and they engage with the people in the community that mosque is in. So like for me, I live in Orland Park, and I pray at the Orland Park Mosque, but I also pray a lot at the Mosque Foundation, which is in Bridgeview. So I kind of think of like Orland Park and Bridgeview, and kind of like all the like distance between me and between Orland Park and the Bridgeview is like, that's my whole community in my mind.
That's interesting.
Yes, it is. That's really interesting.
Anybody?
I can answer it.
Mm-hmm.
In addition to what is mentioned in the slide, it's about a group of people that share the common interest, what a common interest they have. I think it's about the obstacles that they are going through, the hard situations that those people are being through, especially through COVID. What is preventing them now from going to the mosque and what's not. This is what I think, yeah.
Yeah. Yeah, that's a really good point, actually, because these definitions, Dr. Davis came up with these definitions before COVID. So you're right, and one of the things that the Baptist churches are having to deal with is yes, how to sort of facilitate and keep the connectivity going on, keep it happening.
Okay. Anybody?
For me, my definition of community, because I've moved around so much and I've seen kind of in my mind what I define as mosques with a more static population versus a more dynamic population, like travelers or people who come less often with a wider variety, that kind of thing. So, but yeah, the people who are in that area of the mosque are usually what I define as the mosque community, who regularly go to the same mosques, who have a connection to, like, you know, also including like the people that those attendants of the mosque are connected to largely. Because there's a lot of people who are part of the Muslim community, but they're not necessarily the people who show up at the mosque. So I feel like that's kind of what I define as the community.
So you include them, or do you exclude them?
No, I include them because they're in regular contact with the people who are regularly going to the mosque, because it's all connected.
Yeah. Okay.
I want to add to that. Like we always like we have people that like go to the mosque on a regular basis, and then we have like in the Eid, in the two Eids, we see the people that come to pray Eid, and like it's a massive amount of people that we don't see usually. So I think that's the community that Juaria was talking about. Like those are the people that we don't see; they're kind of like hidden, but they're part of the community.
I also have this one comment. I know also, I mean, I agree with both of those statements too. And I also see sometimes there's also a lot of non-Muslims too that come into the mosque too to learn a lot of stuff. And they also sometimes come for services, health services or something like that. So I also think they're also part of that community.
Yeah, that's a very interesting point, because you can see the way in which big data might push us towards thinking about a Muslim population or an immigrant population. But if it's whether you want to, yes, if you feel that the health services are being given to a wider, or there's a need to understand a wider audience, that's important as well. Yeah.
Okay.
Okay, thank you for sharing that. So now I didn't share this slide yesterday because I knew I was going to be talking a little bit today about a bit more detail, but this is and I wanted to give you some tools for engaging with community in whatever way, you know, it'll evolve. The word always evolves. So, but this is Chicago, and this is actually the life expectancies across the city. And remember, I was saying that was one of the that was a sort of that was a measure. The life expectancy gap was an important measure, and remember how much difference we saw between different parts of the states. Well, you can see those differences sort of mirrored. in Chicago. Yeah, short distances to large gaps in health. And I know all of you are, yes, you'll be engaging with mosques in different places and serving different populations. But I wanted to share this with you because we could, I think, an overall goal for our health research engagement is potentially to do what the Healthy Chicago 2025 is, which is close the life expectancy gap. And you can see this as you can particularly see in this map. I mean, how does a map like that make you feel?
I want to move to the loop. Yeah. Well, one thing, I'll definitely be walking more.
So these lines are actually along the they're actually transit lines. So they've done those. So which going back to, I think we're asking you about transit being a factor, is that these are sort of life expectancies at birth near transit lines, but when it gets worse, they get worse when you move away from transit lines, because being able to travel around easily is definitely a health factor. Okay, so I just wanted to share that with you because obviously, again, just thinking about each of you are going to be in different areas, and so there's going to be different sort of life expectancies in those different different gaps in different parts of the city. Okay, so if we go to the next slide. So the question then is, how do we achieve healthy communities, and what can the faith-based perspective add or help us with? So I wanted to share this with you because the Robert Wood Johnson have a very useful, they have some very useful materials on their website. So this is actually a county, this diagram, you can find it on the county health rankings org, but they have, so as you can see, so the goal is length of life, reduce those life expectancies, and quality of life, because it's no good living a long time if it's not good quality of life. So those are their sort of targets. That's what they're thinking. And the Robert Wood Johnson is also a funding body that has traditionally funded community-based organisations across Chicago. So I wanted to introduce you to them as well as a sort of they've been doing some great work, particularly on sort of reducing improving access to healthy foods. And then these health factors, and which are health behaviours, clinical care, social economic factors, physical environment. So they focus on tobacco use, diet and exercise, alcohol and drug, sexual activity. With the clinical care, it's about access to care, quality of care, and then the social economic factors they pick out are education, employment, income, family and social support, and community safety. And then, of course, there's air and housing and transit as well. And then all of the, and there's all that big data driving policies and programs, which are sort of trying to, sort of address life expectancy issues and also quality of life. So how do we achieve a healthy community, and by healthy community, one where there's good quality of life, good access to clinical care, quality of care, and those health behaviours which impact us all so much are reduced. Okay, next slide, Fatima.
So basically, I just have one quick question. Yeah. So social and economic factors actually contribute about 40% to the health equity equation. Is that correct?
They decided that, yes. They decided the ratings. So they wanted some rankings. So they gave social, and this is the Robert Wood Johnson. They decided to weight those social factors so that they were more,
Wow.
Mm-hmm. Yeah, so these are their core, for them, these are the core health factors: health behaviours, clinical care, social and economic, and the physical environment. Okay, so I would, and if you go to the county rankings, I don't think they've updated it since 2017, but there's if you go to that link, they published it in 2018, so it's not as out of date as that looks, but it's yes, they then show you how you can use those rankings and how you can use their data to actually sort of improve community well-being.
Mm.
And then what's happening with COVID is absolutely, I think, this in some ways is almost, there's been an explosion of interest in big data, and there has been community ethnic media has which traditionally didn't do sort of health coverage, has been doing some steps into the breach, realized that they wanted some really local data to help people make decisions. And this is an example of Southside Weekly, where they've been sort of recording COVID-19 deaths in Chicago's neighborhoods. And they have a fantastic sort of map of the mortality rates, unfortunately, but they do have a map of what's happening. So this is real-time big data, which is enabling people to make decisions. It's communicated in a very accessible way through Southside Weekly. I would strongly recommend that you check out your community media as well and see what's happening. Are there Arabic? Is there media Arabic sort of? Are there channels through mosques for information in Arabic?
There are a couple things going on. So there used to be one channel, the weekly program by Yusuf Marai. He had to shut it down because of funding. But there is another one in the Bridgeview community. There is another regular channel by Sound Vision, Imam Malik Mujahid. And then there's another program that's run by Dr. Amina McLeod. So these are the weekly, those are almost regular programming, daily programming, Radio Islam. Do you guys know of any? I think the group might know a lot more than I do, actually. Do you guys know of any weekly or daily programming or newsletter or something that comes out within Muslim communities?
I know that, like, I think like the mosques around us, they send like a weekly newsletter or a monthly, newsletter through email. And I know like there's like I'm not sure if it's weekly or not, but there's like a printed newspaper that's always like available at the mosques in Arabic.
Okay. Yeah. Do you know whether they cover health at all? Is that something, because sometimes they don't.
I'm not, like, I've looked at it like sometimes, but like I've never seen anything about health, to be honest.
Yeah, that's the big gap, Dr. Johnson. And I was hoping to actually have some people on the cohort which are related to the healthcare journalism, but I actually couldn't even find anybody within our community who was doing healthcare journalism work.
Yeah, no, it's very difficult because the journalists have to have the skills to interpret the data, and that's a big sort of thing. Yeah. So, okay. So, cool. But I wanted to sort of, so you've got, yes. So we're already beginning to highlight some assets that maybe, I know we're beginning to share. We talked a little bit about people in the community. We talked about the mosques and the alliances, but we're also sort of beginning to share sort of communication assets as well. This in the end, I think, is often the hardest thing, this bit at the end where you need to get health information out there in an accessible way. And I was really encouraged to see that this paper, it was going directly for big data, and it was making big data accessible to as many people as possible. So I think that's I wanted to share that with you as these are all potential assets, particularly if your mosque is in the south side, and there are also, I think we can sort of map out other communication opportunities in other parts of the city. Yeah. Okay, so if we go to the next slide. So yes, so you have been assigned. You've been assigned for public. These are your public stakeholders. These are your assignments for public stakeholders. So we've got the north side of Chicago. We've got the northwest. We've got Glendale Heights in the west side. And so what Fatima and I were talking about is sort of how can we help? We want to help you obviously engage with those mosques and sort of present yourself as obviously a champion of Picori, but also so that you're knowledgeable enough to explain what Picori is about and sort of translate it into an accessible way, and also show how the benefits. So bring with you some tools which will help you sort of show the benefits of engaging in research to each group. Okay, so I'm just going to very gently introduce you in the last sort of 10 to 15 minutes, very gently introduce you to the idea of asset mapping, and then we will come back to this later on and I will make sure that you have more robust tools. But I wanted to sort of just introduce you to this idea of assets, and we've already, as I said, we've already begun to share the assets that people bring, the assets that mosques bring, you as actually the assets that being part of a faith-based or a network of mosques brings, because you can move between mosques, so you can get to know what's happening in different places. So that the benefit of being a sort of an alliance and a group, these are all assets. So if we go to the next slide. So what is asset mapping? I've sort of used that word a lot. So asset mapping provides information about the strengths and resources of a community and can help uncover solutions. So once community strengths and resources are inventoried and depicted on a map, you can more easily think about how to build on the assets to address community needs and improve health. So the big data will, to some extent, tell you what the health improvements are needed, but the asset mapping will tell you how to address. They will provide you with access, hopefully, to the resources which will help you address those things. Okay, so next slide. So I want to introduce you to 3 tools, and we'll just have one today. But the others are an asset mapping form, which can be used in a group, and there's also a sort of a group in Los Angeles call a stone soup community engagement activity. So which is a very interactive asset mapping activity, and I will take you through that as well. So we will have a sort of way for you to document assets, and then we'll have a way for you to engage a community in an asset mapping exercise as well. And I know that Fatima is also, I love the maps that Fatima's putting together with the mosques. And so what we can do as well is that we can bring in the data. We can sort of map out your zip codes around the mosques to show you we can present some of the data, the big data, in terms of how it's presenting. Okay, and then there's the community hand. So if you get the next, we'll do the community hand just to get you. So yeah, what is a community asset? So we talked about that a little bit. So it's the capacities and abilities of community members. It's a physical structure or a place. It could be a school, a hospital, or a church. It could be a library, a recreation centre, or a social club. It could be a business. It could be an association of citizens. It could be a neighbourhood watch or a parent-teacher association. It could be local, private, public, and non-profit institutional organisations and the data that they collect. So these are all assets which can help you sort of address and meet needs. So if you go to the next slide. So what I would like you to do is I'd like you to think of your mosque as so I all think of a hand, okay? And if you've got a piece of paper, draw around your hand. So what I'd like you to think of your mosque as a sort of what's one health condition you think your mosque organisation supports in your community? One thing that your mosque your mosque or an organisation does to support health. One thing that is a blockage to you, a barrier, a pet peeve that stops you meeting community need, and some programs you think are needed to address community needs. And then just a little known fact about your mosque or organisation. Does that make sense?
So I drew a hand on the piece of paper, and then I'm writing in these fingers.
Yes, that's right. That's right. Right.
Okay. Okay.
Yes. Yes. If I could, I'll show you. If I could show you. No, I don't really want to do that. But I'm going to show you basically what the Baptist, the Pastors for People came up with. I can show you how, and then we can also share some assets as well by doing that. So we've got these. Hopefully we'll have a whole. If we did this in person, we'd have a whole series of community hands. But we can't.
That would be really nice, actually.
But we can create them, Fatima. We can create them. So if people tell us the things, I'll put together a hand for next time.
Oh, that's nice. Okay. Do you want me to move forward?
Okay, so let's go around. Let's do a thumb. So one condition that you feel that your mosque or a community organisation that you are part of supports, and a health condition. So one thing that you feel that is a health condition that is sort of the needs of the community are addressed, or one health condition you think your organisation is aware of, or your mosque is aware of. So that's the thumb.
Salam everyone, this is Meher. I think my thumb, I'm a part of the Islamic Center of Naperville. I think something that they do really well is addressing teen mental health.
Yeah.
When I was in high school, there was like a few workshops and just programs that you could participate in that were entire voluntary, but like led by young people for young people.
Yes.
It was nice to just see that being addressed.
Yeah, that's fantastic. That's great. Yeah. Teen mental health, yeah. Anyone else have a condition that they feel is part of the fabric of the mosque, or an organisation that you, a community-based organisation that you work for?
Well, I'm part of this organization called the Compassionate Care Network, CCN. And what they do is they go to various mosques around Chicagoland and also like other community centers, and then they do like free health screenings, and they try to get the community like to interact with them and be health conscious. So my community is MSI, which is in Glendale Heights. So that's where I've volunteered a few times.
Yeah. Great.
CCN actually has a weight management program.
Okay, as well, yeah.
And they introduced that, right?
Yes.
So obesity is what they highlight a lot.
Obesity. Okay, so that's lovely. So it doesn't, maybe if it's not a health condition, so the health condition would be obesity, but maybe a health factor. No, that's right, Fatima. So, but I'm thinking maybe that's, so if we say a health condition or a health factor, so yeah, exercise, or are there other? That's great. That's good. So weight management is another one. Okay, so those are thumbs. Those are some thumbs. So if you if you have others to add, you just have a think about it. Please do share them. And then a pointer finger. So a thing that your mosque or an organisation that you sort of work with or volunteer with does to support health. So yes, that would also, that could include
some of these mosques actually have exercise programs, or for teens they have these game, the basketball or some those active programs.
Yeah,
I'm sure these guys would probably know more.
I know in the Bridgeview area has been like a number of health fairs.
Oh, okay.
That have been done like the past couple of years. I think it was 4.
Assalamualaikum. Yes, I know that one of the mosques within the community around Islamic Foundation, they do have a lot of sports events, and like, you know, they have teams and leaders like basketball and things of that nature to promote things like exercise and things of that nature.
Yeah. Are these things still going on? Are they? Do you think that they're trying to keep them going?
I think with Corona, they kind of paused like the sports events, but I am not. I think that is something that they want to reconvene.
Yes, they'd like to bring it back. Yeah. Okay.
So I'm also in the ICN community, and they do the COVID-19 support services. So you can do like a hotline.
Yeah.
So that's one of the programs I think they've just started.
That's cool. That's really cool. Yes. And I suppose if we're thinking about faith related, do you have prayer hotlines as well at the moment? Is sort of
yeah, they do like spiritual support, family support, and
yeah,
and medical support too.
Oh right, okay, so spiritual and medical support. Yeah, okay. Okay. Okay, so do you want to share some barriers? You know, actually, I think when we started out, we were sharing, you know, things that what are the barriers to mosques or organisations that you're working with, identifying conditions or supporting health in the community?
I can answer. That's okay.
Yeah.
I think people don't understand how important it is to focus on these stuff. So it's awareness about how they know about these stuff, how it's important to make the health conditions, studying the health conditions in these communities is important. So people, they don't understand how important it is.
Right. So you definitely think there's a role for education and
yes,
maybe about behavioural health and yeah, information. Yeah, okay.
Lack of awareness.
Yeah.
Language and culture.
In what way? In what way do you think that's a barrier? Is the language because things are not accessible?
No, I feel like sometimes when you're some people mainly speak another language that's not English when they go to their community, and then it's hard to get in contact with them to get them to understand things, and then they have a natural fear for getting engaged in things or activities that might support that language or cultural.
Yes, yes. Idea. Do you think there's a distrust of research, or is that
understanding? Probably not understanding, because I personally have heard like some conspiracy theories of what happens when you participate in research.
Yeah.
Just things like that. I think it's a lot of educational outreach type of things that's like one of the really big barriers. Also, like how was being said earlier, how like their part in participating kind of affects the whole. I don't think people connect the two. Like they're like, okay, I'll get involved, but I don't really understand how, like how they can help basically and spread the word. And sometimes like that gets to be a barrier sometimes too.
Okay, thank you. No, that's really helpful. So, okay, so these are all barriers that we need to just be aware of. Okay, so are there programs you think are needed? Do you think there are some really desperately needed programs? Perhaps we might have sometimes when you identify the barriers, it may be that we need some educational tools about to myth bust, as it were, on certain things.
I think one of the main programs that would be needed is like raising awareness about mental health and destigmatizing it, because it's very stigmatized in our communities.
Is that generational, or do you think it's just mental health is just something one wouldn't talk about? Is that in a mosque setting? Is that right, or is it? I was wondering whether it was generational.
I would say like yes and no. Like it's like with the younger generation, it's much more like accepted and open, but like in the mosque, usually like the younger generation is not that active as much. So like the people that are active in the mosque as well, basically is more of like what the community basically accepts or like basically goes along with.
Okay, so that's interesting. Okay.
Yeah, that's these are some really good thinking points, and what we and should become the input in our strategic plans. Yeah.
Just very much being aware of those things. Yeah, I mean, similar with the in some ways with the Pastors for People network. Most of the people who took part in that were older, so they were sort of, let's say, 30s, 40s, 50s. The younger population wasn't so keen on getting involved in research engagement, although actually interestingly now people are, and often it is mental health actually, which is mental health and teens, which is a focus. But I think yes, that's something that we need to be careful of as well, is that thinking about who we're engaging and how that's both benefits but maybe excluding other members of a group. Okay, so finally, the little finger, a little known fact about your mosque. Is there a sort of a little known fact that you can share?
I think like both the Mosque Foundation and the Orland Park Prayer Center, they're Muhsin certified, and I know Muhsin is an organization that basically is advocating for like more access to people with disabilities to the mosque. So I know that Orland Park Prayer Center and the Mosque Foundation are both like Muhsin certified.
That's great.
Mohsen is a very interesting organization, Dr. Johnson. They, because of the disabilities in the community, were not quite recognized or needed to have these religious religious organizations or mosques need to accommodate them. So they actually go around and they see if they are certified for to accept or to have people with certain disabilities. So they actually certify them as, so now and it is not a very old organization. They came out about 3-4 years ago, and now they are accepted as, this is such and such mosque has a Mohsin certification. It's a great program. It's a great program. Yeah.
That's right. That again, these are all assets that we should share with each other, so that we could sort of benefit from. I love that. That's
absolutely
really good. Yeah, and populations with disabilities are often considered vulnerable as well. So that's yeah, that might be there might be some way in which research engagement can help spread that word, and sort of perhaps with a view to making faith-based organisations more accessible than they are. Okay, that's great. Thank you very much, everybody, for sharing that. Thank you. I know it's good. All right, so if we move on to the next slide. So I just wanted to go, yes, so this is an example, and the next one. So it was, these were some examples that were shared by pastors of PCOR. So interestingly, there's some overlap with what you were saying, obesity, and sort of, although mental health didn't come up there, actually, interestingly, when we did that. So that at the time, it was very much, there was diabetes, there was cancer, there was high blood pressure, and hypertension. And then, like you, the group was also identifying education and educators as really important, posting helpful information from the clinic. They also have things like food pantries, martial arts to promote exercise, reaching out to victims of violence, health newsletters, blood drives. Some of the churches do drive-in coding testing, they have developed from this to do those sorts of things as well, and health fairs as well. So great. Okay, and then I can, if you scroll down, I can share the other things that the group shared. So there was they shared that they were vegetarians, that the church was involved in research, and the martial arts was really interesting, and the other things that people were doing, like voter registration, and then the programs they felt were needed was education, health clinics, health tips and awareness, mental health, the long-term effect of incorrect medications, those types of things. And then some of the barriers was lack of health awareness, but similar to what you've identified. The importance of eliminating the salt and sugar, the ugly white things, as somebody shared, and the lack of education, the lack of concern, lack of money came up as well, salaries and unemployment, that was to do with employment opportunities, and food deserts, lack of opportunities for community members to take part in policy. Okay, so those were, and sometimes lack of support from the congregation. It's hard to get people to volunteer sometimes, and that was definitely an important factor in terms of outreach, because they didn't want to overload community members with, you've got to now take part in a sort of 20, a really long program. It was, and also, of course, if you're asking people to volunteer, sometimes that's you have to be very mindful of how much time you're asking for. Okay, so next slide. All right, so if you're interested in following up a little bit more about the information that's available to us about Chicago neighborhoods, the Chicago Community Trust has a summary of assets in 16 planning districts. That's yet another way to divide the city up, but those are planning districts. The LISC Chicago is really interesting because that was about opportunities to access IT and computers. And then obviously every year the Chicago Community Trust has an on the table where it will encourages communities to get together and to have conversations. So I thought those were three useful things that you might want to, you could use possibly in the future. All right, so if you take the next slide. We're just going to close. So yeah, so session 4 is tomorrow. And so if we go to that, I'll just explain, just to say what we're going to try and tell you what's going to be in each session, give you an idea of just a bit more of advance notice. So Fatima is going to take the lead on explaining access to care and patient navigation. And so very much, I think, how all the data gets, well, sorry, Fatima, you say what you're doing.
Okay. Basically, it's primarily about the access to care, different age groups, different income levels, different not ethnicities, but different residential statuses fall into different categories for health insurance or healthcare access. So we will talk about who goes to which bucket, and the system is actually developed already. So people are confused as to where do they fall, but it's all about patient navigation, and somebody needs to help them to navigate to a particular access where they can have all of their medical needs taken care of. So I think we will talk about quite a bit of Medicare, Medicaid, Obamacare, ACA, affordable care, and private insurance, and as well as people who are dual eligible, as well as the so-called undocumented. That's what they call, but it's basically people without a status. They're not undocumented, technically speaking, but they are without status, residential status. So those are some of the things we would do.
Yeah, lovely. And please, and as I mentioned, I know it seems a while ago now, but please come and meet Shilpa. So she's the head of, she helps work with creaky joints and the arthritis power. So she's going to be presenting just for 10 minutes on the patient powered research network, what they do, and also their response to COVID. So you'll be able to get a sense of what a patient powered network can do. So please, if you've got time, just have a quick look at the link I put in the slide on the creaky joints, which is just a link to a blog, which you can read a little bit about. And please come prepared to ask a question or two if you've got time to think about that. So, no, thank you very much. And I think that's unless there are some questions. Sorry, we'll go back to that slide.
I just want to say something that Masood will put the link on the social engine as well. So that's another way to get to the link there.
Mm-hmm.
And so both of those, the slides as well as the link will be available right there in the blog on the social engine. And we will actually end with a prayer because we forgot the prayer in the beginning.
Sorry. Yes, I do. Yes, please do.
Go ahead, please. Any questions? Sorry. Okay, so if there are no questions, I would ask Abdurrahman to recite the prayer for today, please. Jazakumullah khairan, Abdurrahman, for volunteering.
بسم الله الرحمن الرحيم اللهم انفعني بما علمتني وعلمني ما ينفعني وزدني علما. And the translation is, O Allah, make useful for me what you taught me and teach me knowledge that will be useful to me and increase me in knowledge. Ameen, may Allah accept.
Okay.
Thank you.
Thank you, Dr. Johnson.
Okay.
Thank you guys and then we will see you tomorrow at 5 o'clock. Thank you again.
Yeah, thank you. Okay. Join you then. Okay, take care.
Thank you again, Dr. Johnson. I'll end this.